All right, let's dive in.
Okay.
Imagine some of America's biggest companies, household names you see every day.
Sure.
Now imagine their employees reportedly relying on taxpayer-funded healthcare, like Medicaid.
Hmm.
And then what if those same companies had surprising ties to the business world, the investments of someone like Mark Cuban?
Okay, that sounds like an interesting intersection.
Exactly. So our mission for this deep dive is really to unearth that complex web.
Right.
We're basing this whole conversation on, well, a stack of sources. There's a U.S. Government Accountability Office report, the GAO report.
Yep, commissioned by Senator Sanders.
That's the one. Plus business contracts, public investment portfolios.
A good amount of data to work with.
Definitely. It's all about peeling back the layers, trying to understand the financial, maybe social implications of these connections.
Mm-hmm.
We want to help you, the listener, sort of grasp these surprising intersections and what they might mean, so you can draw your own conclusions.
Yeah, absolutely. And just to be clear, we're approaching this as an exploration, right? Looking at the data.
Totally. Not a judgment call.
Exactly. Just laying out what the sources seem to show, these connections within the economy.
Okay, so let's start with the foundation, the scale of this issue.
Right.
Our sources show a significant chunk of the American workforce, even people working full-time, are actually relying on federal aid, like Medicaid, SNAP, food stamps.
Yeah, and that GAO report you mentioned is key here. It really identifies how widespread this reliance is.
So how widespread are we talking?
Well, when you look at the specifics, it's pretty eye-opening. Take Walmart.
Okay.
The report identifies them as a top 4 employer of SNAP and Medicaid beneficiaries in every single state they examined.
Every state, wow.
Yeah, we're talking numbers like roughly 14,500 Walmart employees getting SNAP, another 10,350 or so on Medicaid just in the states reporting.
That's substantial.
And it's not exactly new. There's historical data, like from Tennessee back in 2005. Nearly a quarter of Walmart's workers there, about 37,000 people, relied on TennCare, which is their state Medicaid program.
A quarter back in '05. That really puts it in perspective.
It does.
And it's not just Walmart, right? You mentioned others.
Oh, yeah. McDonald's also ranks high. Top 5 employer for federal benefits in at least 9 states.
Oh, yeah.
Nearly 8,800 of their workers on SNAP. About 4,600 on Medicaid, again, in those specific data sets.
So Walmart, McDonald's. Who else is on this list from the GAO report?
It's quite a list of prominent names. Amazon, Kroger, Uber, FedEx, Dollar Tree, Dollar General, Burger King, Target, Wendy's, Taco Bell, Home Depot, Lowe's, Walgreens, CVS.
That covers a lot of ground. Any standouts there? Like Amazon, I know they talk about benefits.
Yeah, that's a notable one, despite their public statements about, generous health insurance, tuition help.
Right.
They still ranked among the top 10 employers of Medicaid recipients in 5 out of the 6 states that provided that specific data.
Interesting. So, okay, that's the what. What about the why? Why are so many working adults, especially full-timers, in these sectors like restaurants, grocery stores, why do they need federal help? What does the report suggest?
That's really the core question, isn't it? The report seems to suggest it's less about individuals and maybe more about a structural issue.
Structural hell.
Well, that the prevailing wage and benefit structures, particularly in these industries, might just be insufficient. Not enough to provide a living wage for many.
So the jobs don't pay enough to cover basics like healthcare.
That seems to be the implication, which effectively means a portion of the labor costs gets shifted, you could say, onto public welfare programs. Senator Sanders, who commissioned the report, he characterized the situation as corporate welfare.
Corporate welfare. Okay, that's his term for it.
Right, arguing that taxpayers are essentially subsidizing profitable corporations. We're just reporting his characterization here, of course.
Understood. So how do the companies respond? They must have a perspective.
Oh, absolutely. Walmart, for example, they emphasize they're one of the country's largest employers, providing essential access to jobs.
Okay.
They've stated they've invested, I think it's over $5 billion in increased pay, expanded health benefits. Their starting rates are, they say, more than 50% above the federal minimum wage.
And McDonald's.
They point out their average starting wage at corporate-owned restaurants is over $10 an hour. And they also state they don't lobby against minimum wage increases.
So they highlight their scale, their investments.
Right.
But, I mean, do those responses fully address why so many of their full-time people still need Medicaid or SNAP, according to the report?
That's the lingering question, really. While the responses highlight scale and some efforts, They maybe don't fully bridge the gap or explain why a substantial number of employees still seem to require public assistance.
Right.
It points to that potential disparity we talked about between maybe what the corporate offerings are and what employees actually need to make ends meet, especially with living costs.
Okay, so that sets the stage on the corporate side. Now, here's where it gets really interesting.
Uh-huh.
Let's bring in Mark Cuban, a name everyone knows, entrepreneur, investor, sports, healthcare.
Right. Very visible.
We're focusing on his ventures and investments since 2024. And of course, he still have that significant minority stake in the Dallas Mavericks NBA team after selling the majority stake late last year.
Still involved there, yeah.
So, the Mavericks. For the 2024-2025 season, they've got this big network of corporate sponsors. Trime's the main one, extended their deal.
Mm-hmm.
But what's really intriguing for our deep dive are the partners who overlap with that GAO list. The companies whose employees rely on assistance.
Okay, so connecting the dots now.
Exactly.
And this is where it gets more layered. Take Kroger.
Okay, Kroger was on the GAO list.
Right. Employees rely on federal aid, and they're listed as a Dallas Mavericks Foundation supporter.
A sponsor.
Yes.
Yeah.
In fact, November 2024, they teamed up for a Hoops for Troops event, contributed $5,000 in pantry stuff for veterans.
That's a direct link.
Lowe's. Also on the GAO list.
Right.
Also a Mavs Foundation supporter for this season, 24-25, involved in their grant process, too.
Okay. Lowe's.
Then there's Uber, also identified in the report.
Uh-huh.
They partnered with the Mavs for game day transport, promotions mentioned as recently as April 2024.
Got it. Uber.
And CVS Health, another company from the GAO list,
Yes.
listed as a Mavs Foundation supporter for 24-25 as well. They've had an association for a while.
Okay, so Kroger, Lowe's, Uber, CVS,
Oh.
all sponsors or partners with the Mavs, and all on that list of companies with employees needing aid.
Precisely. And just to be super clear, like
Yeah.
you said, we're talking direct B2B contracts or sponsorships here.
Right, not just like Walmart selling a Mavs t-shirt. That's different.
Exactly. This is a direct business relationship or sponsorship.
Okay, but Cuban's world isn't just the Mavs. Let's talk about his drug company, the Mark Cuban Cost Plus Drug Company, MCCPDC.
Right. Launched January 2022.
What's the core mission there? How does it work?
Its mission is pretty radical, actually, to lower prescription drug prices by being transparent.
How transparent?
Their model is basically the drug's actual cost, plus a flat 15% markup, plus a small pharmacy fee. That's it.
Simple. Disruptive.
Very much so. A
Yeah.
deliberate effort to cut through the usual pharmaceutical supply chain complexity and, reduce costs for consumers.
And how does this connect to our other companies? Any B2B links?
Yes. And this is key. The Team Cuban card, their program is accepted at Kroger Family Pharmacy locations.
Kroger again.
Kroger again. Also Meijer and Albertsons Companies pharmacies. These are direct B2B collaborations.
So Kroger is a Mavs sponsor and a partner with Cuban's drug company.
Correct. Shows up on multiple fronts in this network.
And didn't Cuban do something with this for his own employees too?
Yeah, they have a pilot, a funded Team Cuban card for employees at Mark Cuban Companies and the Dallas Mavericks. Shows commitment to the model.
Interesting. Okay, so beyond the Mavs and MCCPDC, there's his investment portfolio since 2024, also pretty broad, right?
Very broad. Focuses on high-growth areas, but also established tech giants.
Like who? Any overlaps there with the GAO list companies?
Definitely.
As of Q4 2024, his public stock holdings included Amazon.com, Inc., AMZN,
Amazon. Okay, big one from the GAO list.
huge one. Also Uber Technologies, Inc., UBR.
Uber again, so a Mavs partner and a stock holding for Cuban.
Correct. The portfolio also includes others like Alphabet, Meta, Netflix, Tesla, Philip Morris, Robinhood, Nike, GameStop, a mix.
And private investments. Anything notable there for 2024, 2025?
Big focus on AI. A substantial $6.6 billion investment reported in OpenAI in 2024.
Wow.
Plus other AI and healthcare tech startups, climate tech too.
And didn't you mention a rideshare investment? That seems relevant given the Uber connection.
Yes. February 2025, an investment in Fedi. It's a group rideshare app,
Yeah.
apparently recommended by his daughter.
Fedi. Okay, so investing in an Uber competitor while also holding Uber stock and Uber being a Mavs partner.
Exactly. It paints a picture of a very diversified strategy.
So how does this investment strategy connect back to the public assistance issue?
Well, it means he indirectly benefits from the operational models of companies like Amazon and Uber.
Because he owns stock.
Right. Even though it's a purely financial investment, not operational control, his portfolio is intertwined with companies whose labor practices, according to the GAO report, lead to workforce reliance on public assistance.
It shows how interconnected everything is.
Investor portfolios, corporate practices, public safety nets.
Precisely. Even when the links aren't direct operational ones.
Okay. Now, for the moment we've been building to, let's really connect these dots. Specific corporations on both lists. Medicaid-reliant workforces and connected to Cuban's network.
Let's break it down.
Start with Kroger. We know. Employees rely on federal aid.
Mm-hmm.
What are the Cuban connections again?
Okay, Kroger.
Yeah.
Yes on Medicaid Reliance. Yes on Dallas Mavericks Connection Foundation supporter, that veterans event partner.
Right.
And yes on other Cuban enterprise B2B, accepting the Mark Cuban Cost Plus Drugs card.
Direct partnership there. Any direct investment by Cuban in Kroger.
No explicit investment found in the sources we looked at.
So Kroger's connection is multifaceted. Workforce needs aid, but they sponsor the Mavs and partner with MCC-PDC.
Exactly. It creates this fascinating tension, doesn't it? A company sort of implicated in the public subsidy issue, but also involved in market-based solutions for healthcare costs and high-profile sports sponsorship.
It really does.
Yeah.
Okay, next. Uber Technologies.
Right.
Medicaid's NAP Reliance for Workers.
Yes.
Dallas Mavericks connection.
Yes, game day transport partner, promotions as recent as April 2024.
Cuban investment.
Yes, Uber stock held as of Q4 2024.
And the Fedi investment on top of that.
And the Fedi investment. So Uber is a dual connection. Mavs partner, Cuban holds stock, all while its workforce relies on public aid, per the report.
Shows a complex strategy there. Hedging bets, maybe? Or just seeing opportunity.
Could be either, or both.
Yeah.
It highlights involvement across different angles of the market.
Okay. Lowe's. Identified employer with workers on Medicaid's NAP, Dallas Mavericks connection.
Yes, Mavs Foundation supporter for 2024-2025 involved in their grants.
Cuban investment.
No explicit investment found.
So Lowe's is more straightforward.
Yeah.
Workforce needs aid. Company sponsors the Mavs.
Pretty direct link there, yeah. Retailer workforce needs assistance. Retailer supports the team associated with Cuban.
Got it. Now, CVS Health. Employees rely on aid. But there's more to CVS, right?
Oh, yeah. CVS is complex. Yes, employees rely on Medicaid's NAP. But CVS Health is also a major player as a Medicaid managed care organization, an MCO,
Yeah.
meaning they directly profit from managing Medicaid benefits. They get paid, often by the state, to administer the program.
Wow. Okay, so their employees need the aid, and the company gets paid to manage that same aid program.
That's the picture painted. Positions them as potentially both contributing to the demand for public assistance via their workforce and being a direct recipient of public funds for running parts of the system.
And the Mavs connection.
Yes, also a Mavs Foundation supporter for 2024-2025.
Any Cuban investment in CVS.
No explicit investment found in our sources. But the Mavs link and the MCO role make it a very intricate connection.
Very intricate. Okay, lastly, Amazon.com.
Right.
Consistently identified.
Yeah.
Major employer. Workers on Medicaid's SNAP.
Yes.
Dallas Mavericks connection. Direct sponsorship.
No direct B2B contractor sponsorship found.
No.
Selling merch is retail, like we said.
Okay, but Cuban investment.
Yes. Amazon, AMZN, is a public stock holding in his portfolio Q4 2024.
So Amazon is a clear financial link. Workforce needs aid. Cuban invests in the company.
Exactly. No direct operational tie from Cuban to Amazon's practices, but an indirect benefit via investment in a company whose model, per the report, involves this reliance on public assistance.
Okay, so we've laid out these overlaps. Kroger, Uber, Lowe's, CVS, Amazon. When we pull all these threads together, what does it all mean? What are the implications?
Well, I think when you see these overlaps, it illuminates some pretty critical, maybe ethical and definitely economic questions.
Such as?
When you have highly profitable corporations where, reportedly, a significant number of employees need public help for basics like healthcare, yet those same corporations are engaging in high-profile sponsorships, like with sports teams, or are part of the investment portfolios of very successful people, it prompts a societal look at corporate responsibility.
The social contract idea.
Kind of, yeah. What's the balance? There's that inherent tension we keep bumping up against. Companies say they provide vital jobs,
Right.
but the data suggests wages and benefits might not be enough for a living wage for many, effectively, externalizing some labor costs onto taxpayers. Who ultimately pays?
It's a fundamental question.
Yeah.
And it's interesting, too, that amidst these connections, you have Cuban's other venture, the Cost Plus Drug Company.
Right. That offers a bit of a counter-narrative, doesn't it?
How so?
Well, MCC-PDC is actively trying to disrupt the healthcare market to reduce costs. specifically prescription drug costs, which are a huge burden.
So it's tackling a problem that contributes to why people might need Medicaid in the first place.
Exactly. Even if it's through a market mechanism, not direct wages, it's addressing a piece of the financial pressure that leads to reliance on public assistance.
So the network has ties to companies potentially adding to the problem, but also includes an entity trying to solve a part of it.
It highlights the complexity
Hmm.
and the value of transparency. That GAO report brings corporate reliance on aid into the light.
And this deep dive tries to map that onto the network of a public figure.
Right. Which raises, I think, an important question for all of us, for you listening.
Okay, so let's recap briefly. This deep dive, we've explored these complex, multi-layered connections
Yeah.
between corporations whose workforces, based on the GAO report, rely on taxpayer-subsidized healthcare, and Mark Cuban's diverse business and investment world, looking specifically at the 2024-2025 period.
We covered a lot of ground.
We did, so what's that final thought for the listener?
Consider this. How do these intertwining relationships where a company's labor situation might necessitate public assistance, yet they simultaneously partner with or are invested in by entities focused on innovation or cost reduction, like MCCPDC or sports teams? How does that shape your understanding?
Your understanding of corporate responsibility.
Yeah, and the effectiveness of our public safety nets in today's economy. What's your takeaway from digging into these connections?
Something to definitely mull over. We encourage you to keep thinking about these connections, the broader economic landscape, long after this deep dive ends.